Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. In this guest, I'm bringing the latest additions to our faculty at the Arizona College of Podiatric Medicine. Please welcome Evelyn Heigh-Rosen and Johanna Richey. Thank you for joining me.
Thanks so much for having us.
Oh, happy to be here.
Well, that's great. I've got a couple goals for our session today. The first goal is that I'm always interested in not only learning about the faculty, but I want our students to learn more about you. And it'll give them an opportunity to get to know you kind of secondarily before you're instructing them in classes. And then secondarily, we're always looking at prospective students and recruiting students to the Arizona College. And I think it's great to highlight our faculty. So I'm really excited about you both being here. So in Dean's Chat, Fireside Chat history, we've always gone by first names. So if it's okay with you, let's go by Evie, Joe, and Jeff. How's that sound?
Sounds great.
Very good.
All right. So Evie, I wanted to start with you. Not only are you a more recent addition to the faculty, but you and your husband Daniel brought another addition into the world recently.
Yes. My husband and I are new parents to a beautiful baby boy who just turned 3 months old. And we're just loving every minute. You know, last night he started giggling a little bit more. And it's just all the fun milestones to watch, you know, enjoying the tummy time, bringing the head up. And, you know, mostly just being parents is one of the most wonderful things I think you can do. And we're just so happy and loving it.
That's great. Congratulations. And Joe, you've got two little girls.
We do. Yes, we have a 5-year-old and a 7-year-old. Very fun ages.
So you both have busy households right now?
Indeed. Yes.
Very good. All right. Let's transition into podiatric medicine. Evie, I'll start with you.
Okay.
If you don't mind, give us a little background on your educational history and how you found out about podiatric medicine and what that journey entailed.
Sure. So, you know, growing up and then going through college, I always knew I wanted to be a physician. I never really knew what type of doctor I wanted to be. I played a lot of sports, was really involved in athletics, and knew that if I could incorporate something in that respect to my professional career, I would really enjoy it. So it really wasn't until I shadowed a few podiatrists that I learned the most and got to see firsthand what a day-to-day would be like, what kind of problems you treat, and that piqued my interest. So once I was able to meet a few podiatrists, I could see myself in that profession. I could see kind of marrying my interest in sports to helping people stay on their feet and recover from injuries. So that's kind of what drew me into the profession. And it's amazing, really, how broad or how diverse our profession can be. So even though it was sports medicine and the athletics that drew me into podiatry, I have grown to develop other interests in the field, like dermatology and wound care is something that I'm just loving now. But little did I know that the profession could be so diverse. So that's how I first learned about podiatry, was just kind of getting my feet wet and shadowing a few.
And where did you do your undergrad?
ASU.
At ASU, fantastic. Yeah, it's like a pipeline to our school. We get a lot of ASU students. Well, that's fantastic. How about yourself, Joe? What was your introduction to podiatric medicine?
So I have a very non-traditional route to medicine in general. I actually started college as an art major. Fine art, to be specific. Moved to LA to go to art school, as you do when you're 18 and young. And through a series of somewhat random events, got really interested in anatomy through a life drawing class. And at the time, I was also doing tutoring for the disabled student office. Started getting really interested in some of the things that those students were having to deal with and cope with, and just interested in those two different areas, and started to do some interning as an animation pre-animation person and realized, actually, this isn't what I want to do. I really loved art as a passion, but started seeing it as an employment opportunity, and it just wasn't quite what I had thought it was going to be. So started looking into nursing, actually, and there was a 2-year wait list to get into nursing school. So I was making a joke to my dad, like, well, by that time I could have taken the MCAT and gotten into medical school. And he was like, well, like, is that what you want to do? And that moment where it's like, oh man, like, what do I really want to do? And I really didn't know what I wanted to do. So I went into kind of I transitioned my credits to more of a pre-med track, and then just started shadowing a bunch of different doctors, and I was going to Midwestern in my undergrad. They no longer have that bachelor's program, but I did that bachelor's program, and the podiatry program was new. And so I had never even heard of podiatry, but that was actually my first introduction. I was like, ooh, this is an interesting thing. What's this? And so when I started shadowing different doctors, the ones that I really liked infectious disease, really loved rheumatology. And then what was really interesting, when I shadowed a couple of different surgical fields, obviously I didn't get to go into surgery with general surgeons or orthopedics, but it might have just been the podiatrist's personality at this point, like looking back retrospectively, but he absolutely loved his job. He was happy, got to see everything from little kids to elderly people. And some of I only went to 2, but 2 surgeons didn't have the same like pep and joy in what they were doing. And again, as an outsider looking in, it was, to me, very obvious, like, well, I want to do what this person's doing, because they seem really happy. Like, they really love what they're doing. And it was neat to be able to incorporate the surgical aspect for all the artistic skills that I wanted to be able to still use, but then also be able to integrate this whole other part of this new interest that I had in medicine in general. And so it kind of seemed like a perfect meld of these 2 things. And then when I learned more about what the program offered, this idea that I could specialize right out of the gate, like, again, at that point, it took me 5 years to get through school because I changed majors about 4 or 5 times. But in my random wanderings, not wanting to continue to spend even more time, knowing at some point I wanted to have a family, or I thought that I wanted to have a family. And so to spend, 12 years trying to get to a point and then be tired all the time and just frustrated, that didn't sound as appealing. And I have loved every single day. I've never looked back.
You embody the art of medicine.
Quite literally.
That's fantastic. So I have a question for both of you, kind of digressing a little bit. It's amazing how impactful the shadowing opportunity can be for students as undergrads. Can you comment on that? And obviously it had a lot of impact on you and your decisions. Evie.
Yeah, it's something I would definitely recommend trying to do, or maybe reach out to a school if you don't know of a podiatrist that's open to having prospective students shadow, to inquire about that. But I think it's a great thing to do just so that you kind of have an idea of what you might be getting into, because our profession can vary from physician to physician. It's nice to be able to kind of keep your mind open to the various parts of podiatry. So there are some doctors that really do a lot of surgery. There's others that enjoy the clinical side of it. There's some that practice in hospitals and others in multi-specialty groups. So there's so many opportunities within our profession, even though it's, a smaller profession. There are just so many different avenues you can take. And I think the more you can learn about it, the better position you'll be in to feel confident about your career choice. And also the more people you can ask questions to. It's nice to be able to have a contact or somebody that you can bounce questions off of, or ask about their experiences to help you make, informed choices going forward. So I enjoyed my time shadowing different docs.
Well, like Joe said, the podiatrist was happy, and maybe the reason they are happy is because they can tailor their practice to what they like to do.
Right.
And that's not always an option for other specialties.
Right. And again, it's fun to kind of look back and reflect. And I always, just knowing this doc now, also outside of practice, he's just a genuinely happy kind of guy. But it's funny talking to like staff in the hospital, they love the podiatrists because we're the fun ones, right? We are the happier ones. And I think it's important too to recognize it's not that podiatry is less stressful than other fields of medicine. And I think sometimes that kind of gets artificially out there, like, oh, hey, come to podiatry because it's easier. And I think that that's not really fair to say. I think what's important to say is there are so many opportunities during our day that we make a positive impact right there. And we get to see those results in real time. And not every part of medicine gets that same feedback. And so sometimes, too, when I have students that'll come and rotate, what I tell them is as you go and you explore, one of the best things to ask people, what are the hardest parts about your job? Because when you're trying to figure out, like, what kind of specialty do I want to go into of anything, but certainly we'll focus on medicine. What is, you think about all the good things, like, oh, I want to do, I want to be a nurse that does, baby care. And you think about all the wonderful days and how cool that would be. But it's also important to realize every job has the pluses and has the minuses. And the minuses are what can be hard. And so is this something that I think I can do, that I can handle the minuses? Because the pluses are easy. And with every specialty, I think that's important.
Oh, I'm with you. And there's no question about that.
Yeah.
There's that old saying that the leaders do the right thing and managers do things right. And it's kind of interesting because as a doctor, you're the leader, you're caring for the patient, but there's a part of your job that's going to require managing things like electronic medical records that you might not like so much. And that's true for everything. Right. So you are both graduates of the Arizona School and now College of Podiatric Medicine. Can we spend a few minutes talking about that?
Yeah.
I imagine, like me, one of your mentors is Dr. Page.
Absolutely.
Yes.
Now, let's talk about Dr. Page for a few minutes. What was it like when you first met Dr. Page, Evie?
Oh, he was just a wonderful person in general. Before, being the dean of the Arizona School of Podiatric Medicine when I attended, he's just a kind human being. So always there to chat with, very open and, ways to help you and support you. It was one of those kind of interactions where when you went to go talk with him, you knew that all he wanted was to see you succeed. And he was there to help you achieve what you wanted to achieve, whether it was just pointing you in the right direction of who may be the best person to help you with, I don't know, biochemistry issue, or whether it be looking into opportunities like residency programs. What do you think would be a good fit with my personality, with my career interests? He just was wonderful. And I think you embody so much of what Dr. Page was for me when I was a student, is the way that you're there for the students. And, that was one of my most favorite things about Midwestern was what a community it is and how much support there is for the students. And, you're going to get that top level education. And along with that, you just have the people to be by your side to help you get there.
Absolutely. Well said. Joe?
Yeah, pretty much same exact experience. Just overwhelmingly, the thought that came to my mind was kindness. He also carried himself with this professionalism that I think is so important. It's incredible as you progress through your career and you meet different types of personalities and people. And Dr. Page was one of those people that not only was kind, always professional, but he was also incredible at what he did, right? And he had this huge background of accolades, but you would never hear him spouting his own successes. Right. And again, it just speaks so much to the kind of human that he is, that he was more interested in having all of us succeed than try to build his own name or make him into something. Right. He was already something, and he didn't need to show that off.
Absolutely.
Any more than making all of us great. And I think that that's incredible.
Yeah, it won't surprise you at all to know that he was just like that 30 years ago. Yeah. Because when I was at the California College of Podiatric Medicine as a student, I worked up my first patient with Dr. Page. He was the director of clinical education at the time. And he's been a mentor to me for 30 plus years. So Yeah, he's just a fabulous human being, no doubt.
Yeah.
All right, well, let's talk about residency training. And, I know that we're so proud of our graduates. Like this year, for example, our graduates are going to 18 different states to top residency programs around the country. And I know that's been the case for many years. Can you each talk about your residency search and where you landed and maybe some of the mentors you had throughout that process? Joe, you want to go first on this one?
Sure. So I did my residency in the San Francisco Bay Area with the Kaiser Permanente North Consortium or Central Consortium. Now there's so many, I'm not sure exactly, but the San Francisco Kaiser program. It was a 3-year surgical residency and it was hard, but it was amazing. And looking back, I'm so grateful for my education because my very first rotation was general surgery, which was a little terrifying in good ways, but also just in the ways that you don't know what you don't know until you're right there in the thick of it. And so the nursing staff were amazing. The nurses know how to do everything. And so as I was going through things in my own mental processing of running through my differential and what was going on. You walk in a room and my patient wasn't responsive. It's like, oh my goodness. And the nurses come in and they're just super chill and calm. And they're like, these are the things you need to order. And it was like, thank you. And then it's like, call my chief resident. But it was such an incredible opportunity to spend, 1 month doing something that was totally different than what I was planning for. And again, for me, it was such a re-emphasis for why I love what I picked to do and why every time I would do an outside rotation, I would have moments where I'm like, oh, that was so cool and that was so neat. But I'm really glad it was only 4 months or 4 weeks or 8 weeks or however long the rotation was. And then you go back on your podiatry rotations and it was just fun. It's definitely highs and lows like anything in life. And there were a lot of late nights. It's a lot of hard work, but that's a good thing. Work is good, especially when there's a timestamp, right? This is your opportunity to go and learn as much as you can in 3 years. And you'll look back and be like, wow, that wasn't that long. That was really fast. When you're in the thick of it, I remember my second year was a lower point because, again, it's just a lot. Your whole life is residency, basically. We had a high emphasis on research as well. So if we weren't actively working and on call, a lot of the time was spent doing research. And there's certainly some, flexibility in terms of personal time. But again, the emphasis is you're here to learn, you're here to do. So here are all the things you can do. And I remember in my second year having a moment where you're just kind of like, wow, this is just a lot. It's a little overwhelming sometimes. And having opportunities to talk to other mentors and people. And I'm so grateful for the faculty of my program that they were always open and willing to talk about, these are the things that are hard for us, or, hey, come in here, let me show you this complication that I just had. And it's like, oh, okay. All right. Life has ups and downs, and it's not just learning how to deal with that in general, as I think everyone on the planet is doing, but then professionally having those ups and downs and learning how to manage it and know that you're not alone was really great.
1,000 days go by pretty quick.
They do.
Yeah,
Definitely do.
I used to tell my students and residents, learn everything you can. You need to learn something new every day because next thing you know, you're going to be out in practice, seeing your own patients. And
I think, again, as a testament to my training, when I distinctly remember coming out and having that moment where there wasn't anything that I felt like couldn't come into my door that I couldn't handle. Doesn't mean it's what I wanted, that I would choose to do all of the things that I was trained to do, but just being comfortable knowing what to do, who to get this person to, what, how to manage anything. And I remember having that moment of wow, that's the sign of a really great program. I could go anywhere. I could go in the middle of nowhere and practice, and anything that walks in, I'm going to know what to do. Whether I do it or not, just knowing what to do and not having fear about what we do. And that was great.
That's a great feeling. Sounds like just an incredible experience for you.
It really was. It really was.
Evie, what was your residency experience like?
Yeah, so kind of like what Joe was sharing, there's ups and downs, and it's a journey. And there's the path to residency as well. And I remember as a student, I wanted to kind of get a taste of a lot of different types of programs. So before I, ranked the place that I wanted to be at the most, I had the opportunity in my 4th year to experience a variety of different programs. And I was so glad I did, because there's some variation from one place to another place, and you get to see how things are like, on one coast versus another coast. Being from Arizona, I wanted to kind of branch out a little bit, and I got to experience programs on the East Coast and the West Coast, and I ended up matching with a program that I enjoyed so much and was just so thankful to have that education and training. It was with Northwell Health System. It was called Long Island Jewish Medical Center. And I knew that was the residency I wanted to match at for a few reasons. I looked at the senior residents and what they were doing, and I knew if I put in the hard work and the long hours and just show up every day and do my best, those are the skills that I would have under my belt, and I would be able to treat patients no matter what they come in with in the lower extremity. I would feel comfortable. So I would look at what the senior residents were doing. I would try to feel that I could connect with the attendings and know that having a variety of people to work with was important. You might find the bedside manner of one something that you really aspire to have, or the surgical skill set of another that you're looking to learn from. So there was a lot of factors that went into where I matched at. And the other thing I would look at is what kind of experiences would I get. And I knew that I would have a good experience with a heavy inpatient load and know how to handle wounds, as well as there was a pediatric hospital associated with the residency program. So I would get to see children come in. And one of the attendings that I ended up connecting most with, she was a former basketball star at Fordham, and she had a sports medicine experience, and I would enjoy going with her every month to Fordham to help those athletes and things like that. So the residency experience it can be grueling and it's tough, but having the education that we did under our belts, I think, really prepared us well. Knowing that you have the knowledge, you have the book smarts, and now you just need to be able to apply it. And it's a time for learning, and nobody's born with all the answers, and everybody wants to do a little bit better tomorrow than they did today. And having that mindset that you're here to learn and here to grow, and you're not going to, know all the answers, but you'll know them, in the future. And I was really glad with my decision, because it put me in a position where after completing the residency program, I felt confident in my abilities to treat, all conditions of the lower extremity. And then kind of I had the opportunity to say, okay, well, how do I want to practice? And I ended up choosing to do a fellowship after my residency that focused a little bit more on sports medicine for the outpatient athlete. So that was through UCLA that I completed, and kind of brought me to the West Coast, where, being from Arizona, it was nice to kind of make my way back home a little bit, but also gave me an opportunity to do some research and kind of find my bearings a little bit of the kind of podiatrist that I want to be. So lots of different experiences, and just really trying to make the most out of everyone and be a sponge and absorb as much as you can, because you're only a resident and you're only a fellow for so long. And then, it's how you choose to move forward.
Can I piggyback on something that she had said?
Of course.
Oftentimes students will always ask, how do you pick a program? How do you know? And I think you had said something, Evie, about you went to a couple different places, East Coast, West Coast. And I think it's hard to know which program is completely right for you. but you will know the ones that are not right for you. Right. And it's funny. One of my really great friends is a residency director, and she and I will talk, and it's like kind of like dating, right? Like you're trying to get to know the program. They're trying to get to know you, and you're trying to put your best face on all the time, but at the same time, it's okay if you go somewhere and it's like, this doesn't feel like it's right. That's perfectly fine. Like you'll know in about a half a day if it's just not right for me. You won't necessarily know in a half day, like this is it, this is the one, but you'll know if it's not. And that weeding out process is also really useful. So I think anytime you get a chance to visit a program, that can be helpful. Mm-hmm. I actually went up in my second year, because again, students are like, well, when do you go and you visit? In my second year, I went and visited the program that I ultimately went to. And it was such a great experience, because it was one of my mentors, Paul Kim, was like, you should go check out some of these programs. And it was like, oh, I don't know what I want to do. And he's like, just go check it out. Because if you don't want it, that's cool. But at least you know where to go from here. And it was such great advice, because I got up there and it was like, this was a world I didn't even know existed. And I wanted more. So I knew that I wanted to do a lot of my rotations or externships in that kind of Pacific Northwest area. And so I liked what you had said about that, and triggered that in my head about what students will often ask, like, when do you visit? How do you know how do you decide which externships you want to go to? And I think those are useful questions. And unfortunately, sometimes by the time you're in your third year, well, now it's not too late, but you've gotten so far, it's hard to squish it all in as fast as you can before you have to make decisions. So even though you don't feel like you have all the knowledge as a second year to go out, that's okay. When they know that you're a second year and you're just visiting for half a day, that's okay. You're not going to blow it, but I think it's useful to just get information.
That's such great information and great nuggets of wisdom, if you will, for the students. So thank you. So you both went into practice for a few years, different practice settings, of course, and I welcome you to comment on that. But when did you know that education was in your future? Evie.
Yeah. So after fellowship, I joined a multi-specialty group that I was with for a little over 3 years, and I was able to, build a successful practice and have that interactions, with the rheumatologist and the neurologist, and back and forth, and it was really special and wonderful, and I enjoyed that setting of practice very much. But some of my most favorite days were those days and the months where I would have students with me, podiatry students. It, it keeps you on your toes, and it just is a breath of fresh air and fun. And it's just, I think, helping others learn and encouraging them to kind of apply the knowledge that they have and help them, with those first patient interactions. It's very rewarding. As, a physician myself, I enjoy, teaching, and it makes me feel good, and seeing them, succeed is satisfying. And those, the times where I would have the students with me were great. And then I had the opportunity to do a little guest lecturing here and there, and it's just something that I enjoy, and being able to, share knowledge with others and help them grow into a physician is a special opportunity, and something that I really enjoyed. And there's a lot of different aspects about, academic medicine, right? So we can, be part of a college like the Arizona College of Podiatric Medicine, or we can contribute in other ways too, with research and things like that. And that's always just kind of been at the top of my, professional goals, is to be able to contribute to the medical community, and whether that be educating students or working on a paper or a case report or poster, just kind of having that inquisitive mindset of me wanting to learn, and then also helping others learn as well.
Well said. How did that work for you, Joe? How did you kind of gravitate towards education?
Yeah, so I completely mirror what you're saying. I love learning. Since I was 2 years old, I have loved learning anything and everything. probably why I changed majors like 4 times, because you learn something new. You're like, oh, this is so interesting. I want to learn more about it. One of my majors at one point was education. I was going to be a biology professor. Again, like, ooh, biology, this anatomy stuff, and then all these things. It was just melding. I always loved when we had students when I was a resident. Well, I tutored in school, so I did some of that experience, and I loved that moment where you see people make that connection and, oh, I get that now. Like, that was such a rewarding, positive feedback loop for me that I was just like, I love this. So as a resident, I loved when we would have students, because I would bring them, and maybe to some students' chagrin, like, not torture them, but like, let's talk about this and let's sit here and run through this. And even my junior residents, I remember one of them who I absolutely adore, who was an Arizona grad. He was a first year and I was a third year, and we had a 3-month block together. And I think toward the end of it, he was almost like, can I like jump out of the nest yet? Like, you've been with me all the time. Like, can I go do this by myself? And that moment where you're like, yeah, I think you're ready. You know, I loved that mentoring part of it. And he's a superstar now. So it's neat to see that development for people. So as soon as I graduated residency, I had reached out to I got hired with the program that I was with. So I worked in the Kaiser San Francisco residency program as an attending. I was in the Walnut Creek, Antioch area. And I reached out to the California school and said, hey, I would love to be involved in any way you need help. And at the time they were looking to hire someone. So I actually ended up kind of signing up for 2 full-time jobs unexpectedly. But just loved every minute of it, and ended up working it out. So it wasn't 2 full-time jobs, because that was not really possible or sustainable. But another one of those moments where, again, if there's something that as a student, you have a vision for how you want your life to be, don't let people tell you can't do it. You can create any life that you want. It may not be easy, but you can do anything you want. And sometimes you just have to be willing to ask. And I have continually been pleasantly surprised how when I want something, I have to do my part and work hard and be willing to show up and be willing to work maybe longer or harder to do what I want to do in the way I want to do it. But it's amazing how many people want to support you in doing those things. So it was wonderful to be able to work as a faculty training residents and teaching, but then also to be part of the students and teaching the students. And I love working with students, and I just think it's such a rewarding experience. So I moved away from academic practice and moved for family reasons to be a little bit closer to home, and was in a private practice situation. And I instantly missed the residents. I missed the students, and they had medicine residents. And so this was really funny, because I reached out to all the faculty at the hospital and said, hey, I know they're medicine residents, but if you need anything, I'm happy to help. And then COVID hit. I was going to do some lectures, and then COVID hit. So everything kind of changed pretty dramatically. But anytime I would run into residents in the hospital, I'd be like, hey, you want to come sew this ankle up with me? I'm about to go to the ER. And they loved it, because they don't always get to do all the hands-on procedural stuff. So I had a couple come in the OR with me, and it was great. But again, really solidified for me, practice is great. Practice is fun. You get to do your own thing, have a little autonomy. I got to really focus on the family stuff, which at the time was really necessary. But I missed that part of what brought me joy. And I could feel it, not soul sucking, but kind of less dramatic, but I could just feel that there was this gap. And again, when COVID hit, then the California school, I had offered when we moved, hey, I can, do some remote stuff if you want me to, try to do virtual things, or I could fly up. And obviously at the time that wasn't really the vision, and I totally understood. But when COVID hit and now everything is virtual and everything's remote, they had reached out, and it was that moment where it's like, hey, you remember that offer to do some virtual stuff? Would you be willing to consider that? And it was just like, yes. And at the time, again, our community got hit really hard with COVID, and it was definitely a moment of I have no idea how we're going to figure out how to do this, but my answer is yes, because I need to fill this gap. And honestly, I think it saved my life, my own mental health, to have that part brought back, especially in that part where the whole world changed. And I think everyone got hit really hard. So
I think that the California school is very fortunate that you had time and the initiative and the energy to help them.
yeah, it was mutually beneficial.
Good.
They're wonderful. Yep.
Great. That's a great story.
Yeah.
So, Evie, you've been at the Arizona College now for over a year. Tell us what your first year was like and which courses you were teaching and your interactions with the students.
Yeah, sure. So when I first joined the Arizona College of Podiatric Medicine, I took on the medical imaging course for the summer quarter. These are the new second years. And it was a great experience. I was able to kind of I had the material that needed to be covered and the curriculum and the objectives, and I was able to build the lectures in a way that I felt I could communicate the points across well. And I that was my first time actually presenting as a instructor or course instructor. So there was a learning curve, and I really just enjoyed the experience, and also, would make notes after every class, what am I going to do different next year? Because I, probably like both of you, you always want to, improve upon yourself. And, so I look at, what I do with a critical eye, and I say, okay, well, how can I improve on this better? So, this year we're doing a little bit more hands-on things. I have some new examples. I have some different cases to share, but it was very fun to kind of put my twist on this course. And being in practice for about over 3 years before coming here, I had various cases that I could share and different ways to kind of push the topic forward. If I had a radiograph from a certain, surgery I did, or how a patient presented, I was able to share that to kind of make it more real. But it was good. And this summer, I'm teaching the medical imaging course again, and I'll be taking on the dermatology course later on in this summer for the third years, which I'm really excited about because that has become such a special interest of mine, is skin conditions and limb salvage and stuff like that. So I'm really looking forward to that as well.
I know the students, when I see them in the halls and in labs, they always comment how they love being in the clinic with you also, Evie. So.
Yeah, and I enjoy that so much. And that's one of my favorite things about this, about this career. So I'm able to teach in the classroom, but then I also get to maintain the clinical side of practice and see patients. And, I like to take care of them, in-house when they're in the hospital with an infection or whatnot, and then be able to see them, heal and things like that. So there's the whole scope that I really am not missing out on. And I love the variety of it all. And
that's great. Joe, when you were teaching virtually for the California school, what courses were you teaching and how did that go? It must not have been easy.
No, it wasn't. And, I have to say, all of the students that went through COVID, they all need a giant high five, because to be so willing to be flexible and adaptable, literally within hours, or days of something has to change and we need to figure out how to do this. So I know we talked about this the other night at the graduation reception, but those students are going to be phenomenal practitioners because they've already had to go through something that was painful to come out of your comfort zone, come out of the way that you're used to doing things, the way you're comfortable doing it, and you have to learn how to adapt and be flexible. So there's nothing that's going to come at them that they're not going to be able to tackle, because hopefully we never have to go through something like that ever again. But if we do, they're already equipped with the skills and the knowledge of, hey, we can do this. We've been through it. So let's, put the smiles on, put the music on, and let's just get to it. So to answer your question, the courses that I was teaching, I kind of took over all of the surgical curriculum. As I was talking with Eric and Sherry, the idea was, because we didn't know what was going to happen with the way that the world was going, and things would open and then they would shut down, to just trying to keep some continuity and know, when things are covered and make sure that there weren't gaps or things that fell through the cracks. And so from a didactic portion, it was only the didactic stuff. I didn't try to do anything clinical online. I know they did have to navigate that because California had some restrictions in terms of, just as a lot of places did, but in terms of how to manage that, and in-person stuff was challenging, again, nationwide. But so for the didactic portion, what was interesting, the way I initially had approached it, it was, well, this really isn't any different than what I've done before. It's just a PowerPoint, right? But the reality is it was so different because that interaction part was gone. I mean, it's not, they're all there in Zoom. I can see their little cameras, but it's awkward. It's clunky. It's difficult to, somebody wants to speak up, but then somebody else does, or then you ask a question and there's a big pause because they have to try to figure out how to unmute. It's just, everything was harder and sludgier to kind of get through. So you just have to get creative, and you try to come up with new ways of doing things. And so we started doing more cases, kind of simulated stuff through Canvas. We were going to post some stuff. And again, each year I learned something new, hey, this, and the student feedback was always really useful. I know they hate us harping them about, please fill out your evaluations, right? But it really is useful. And I tell them, constructive feedback is good. It's helpful to me. Not constructive, not so helpful. That just hurts my feelings. But constructive feedback is great. Hey, we liked this. We didn't really like this. This didn't really contribute to my education, because it helps us figure out, okay, let's cut that part out and let's do more of this. So the next year we did more cases. If the first year through COVID, it was a bonus points. Because again, it was challenging to figure out navigating digital exams. From home, not just digital exams, but digital exams in your living room, and all of the things that go with that, But again, I really have to just credit the students for their willingness to be flexible and adaptable. And I know the very first year, or the first semester that I did, the students were just really grateful that I think that somebody cared enough to say, we're going to make it work. We're going to do it. And that, again, that positive feedback for me, all right, if you're willing to work with me, let's do it. And again, I think it really saved my own mental health, just finding ways to be creative and give back to them in a way that during the day you're giving back in more challenging ways, especially during COVID, that it was a nice way to balance some of those emotions for me.
The students are so smart, and they're so willing to learn, and
they're so tech savvy.
Very much. But we spent a great deal of time during our strategic planning meeting this year talking about how are we going to connect with students and optimize that learning experience. Yeah. And what you're talking about is exactly what we need to continue to work on.
Yeah.
Very good. So we're getting a little short on time, so I wanted to ask you one last question. We're recruiting students nationwide, of course, and we've had a little dip in the recruitment applications. And I was wondering what each of your thoughts were, and what potentially your thoughts are how we could remedy that situation. Evie.
Yeah, I would encourage prospective students to keep an open mind about the profession and everything that it entails, and learn about it. Connect with the university to talk with students, or visit a school, or just check out their website and see what kind of resources there are. Because there's nothing like talking with somebody and really asking questions. That's one of the best ways you can learn about interests, and just be proactive as you can, with an open mind, and know that podiatry is such a diverse profession. Even though we're treating, the lower extremity, there are so many aspects to that. There's biomechanical aspects, there's surgical aspects, there's skin aspects, there's, joint situations. There's just so much that goes into treating patients with a lower extremity issue, that if you have an interest in medicine in general, this may be a career path for you.
Well said. I like that. I agree with you. Joe, what do you think?
Yeah, very similar. I think we've already touched a little bit on some of the things that are great resources for students. Shadowing, again, I can't emphasize, if for any health career-minded individual, if there's something that you think you might have interest, hey, I just want to help people. I don't know what I want to do. Maybe I want to go into nursing. Maybe I want to go into PT. Look at everything. I had no idea how many opportunities in healthcare there are. And so there's something for everyone. And having the opportunity to find someone, and you know, there's resources out there. The college has resources to help find people that are willing to have you come shadow. And you can even call sometimes offices and say, hey, are you willing to have a student? That was how I found the person that I shadowed. And it's helpful sometimes to get recommendations on where to go to get those opportunities. But at the end of the day, just having that exposure and being able to see and recognizing that that's one office. And there are so, like Evie said, there are so many different fields in podiatry alone. If you want to do reconstructive surgery for these complex deformities, if you want to do pediatrics, if you want to do sports medicine, if you want to do limb salvage, if you want to do trauma, there is so much opportunity out there. And you don't even have to specialize in just one of those. If you want to do all of it, go for it. You can do all of it. So again, there's so much opportunity to find what you want and make it what you want it to be. If you want to go into academics, like, you can find all of the things that you want to do and piece it together and create your ideal career and your ideal life. And I think that is really exciting.
I agree. Well said for both of you. I just wanted to thank both of you for coming on the show today. All your time and your energy, and it just sees through. And I think that our students see it also, and they're really so fortunate to have you as their professors going forward. So again, I want to thank you for coming on the show. And to our listeners, I want to thank all of you for tuning in. We will continue to bring you the voices and leaders in podiatric medicine. And until next week, cheers.